Good morning and welcome to the second IForum in our 2015 series. I'm Alicia Woodsby. I'm the Executive Director of the Partnership for Strong Communities. We are a statewide nonprofit policy and advocacy organization dedicated to ending homelessness and expanding affordable housing to strengthen Connecticut's communities. I'd like to thank the Melville Charitable Trust, Webster Bank, the Connecticut Department of Housing, and the Connecticut Housing and Finance Authority for their continued support of our annual IForums. And the State Department of Education, Connecticut Coalition to End Homelessness, and the Center for Children's Advocacy for their partnership on and considerable contributions to this event. I also want to recognize and thank Commissioner Yvonne Klein for joining us this morning. And I want to thank our excellent lineup of speakers today and recognize and thank the great staff here at the Partnership for Strong Communities, especially Elizabeth Grimm, I don't know where she is, for all of her hard work and leadership in coordinating today's event. We dedicated this IForum to the important topic of youth homelessness. Youth and young adults experiencing homelessness are an invisible and vulnerable population. And if we don't identify them and intervene early, all available evidence points to long-term and costly consequences on both the individual and the systems level. Much of the statewide work we'll highlight today comes after Invisible No More. It's a 2013 study conducted by Yale, which found high rates of school dropouts, engagement with multiple state systems, early sexual encounters, and multiple traumatic events, among other negative outcomes for this population. And it reinforced what we already knew, that traditional methods of counting those experiencing homelessness have not captured this population. But through lessons learned from the study and strong planning partnerships between multiple stakeholders across multiple sectors and areas of the state, we have many exciting developments to share with you today. I want to take this opportunity to invite folks to the Homestretch documentary, which will be here on April 9th from 5:30 to 7:30. We'll view a powerful documentary on youth homelessness, have a panel discussion with youth, and engage with legislators about this important topic. And we've made it very easy for you. I think we actually have registration forms on your chairs. So all you have to do is fill them out and actually just leave it on your chair, and that will get you registered for the event. I now have the pleasure of introducing Jasmine Hayes. Jasmine Hayes is a policy director with the U.S. Interagency Council on Homelessness in D.C., where she works across federal agencies to help shape policies and address homelessness among families, children, and youth, as well as increasing access to employment and education. Prior to USICH, Jasmine was with D.C.'s Child and Family Services Agency, where she served as program administrator for the state-level Office of Planning, Policy, and Program Support. She'll share her deep knowledge on this topic with us this morning and offer a national perspective. So please join me in welcoming Jasmine Hayes.
Jasmine Hayes. Delighted to be here and happy to bring readings from our interim executive director, Matthew Doherty. This is really exciting for me personally. I joined USICH in September, so it's officially 6 months. And in my role, I've had the chance to meet with a lot of our federal partners, of course, but increasingly I'm becoming more familiar with the work that's happening across states and at the local level. And what I can say is that there really is this tremendous momentum that's been created, I think, building on, what has been years of work. And so it's really exciting to be here today, and I look forward to learning what's happening here in Connecticut and being able to take that back to the federal partners. So I think most of you are familiar with USICH. We are the federal agency that's charged with implementing the Opening Doors strategic plan to ending homelessness. No small feat. There are 19 member agencies of the council. We are currently chaired by Secretary of Labor Tom Perez, and Sylvia Burwell is our Vice Chair, Secretary of Health and Human Services. I think it's really important when we think about the representation on the council. Obviously, Department of Labor has really looked at homelessness, I think, and identified opportunities within current legislation. We know we're not supposed to call it WIOA, so it's WIOA. The regs are coming out, but there are a lot of opportunities within that, I think, to support youth in a way that hasn't happened before. And I think a lot of that has come from within the agency. And for many of you, I think, that probably have heard Secretary Perez speak, this is a very personal issue for him. He is very connected to what's happening with our most vulnerable populations, including those populations experiencing homelessness. And you'll see that when he's out in communities, and I think even when he's talking about the agenda that's being set by the administration. So in our capacity at USICH, we have a number of interagency working groups, and so we're facilitating those connections at the federal level. And then on the local level, we have a number of regional coordinators. Some of you may be familiar here with Bob Holster. Some of these work with a number of folks here in Connecticut. And they really are our connections between what's happening on the ground and then where communities need some of the extra guidance. And also letting us know where perhaps policy or program planning happening at the federal level is not syncing up with what really is happening. So opening doors, I'm not going to spend too much time on this. I think everyone is familiar with this. This is our national plan. States have really been able to wrap their arms around it and use it as a blueprint. For us, it really is very clear. We have 4 distinct goals. There are obviously a number of strategies and objectives underneath each one, but all of this is driving us towards our ultimate goal of ending all homelessness. So the themes of opening doors really are what we feel are going to drive all of our work forward. The primary objectives fall across these themes, and we start with increased coordination, leadership, and engagement. And this is critical, because in the absence of this, we know all the work that we're doing is not going to be able to move forward. Increased access to stable and affordable housing. Again, we could do all of the work in terms of supports, but in the absence of available housing and housing supports, we know that our most vulnerable families, our youth, and individuals experiencing homelessness are not going to be able to sustain housing. And that's tied to increasing economic security. So making sure that families and youth, individuals who are eligible for mainstream benefits are actually connected to those benefits, and that they have opportunities for education and training programs that are really going to move them on a path to self-sufficiency and being able to maintain their housing, which then means having access to health care and all the resources that are affiliated with that. So if they need supports around mental health, substance abuse, that they have access to those resources and that it can be part of a package of supports that are available to them. And finally, retooling the homeless crisis response system. For us, what that means is at the local level, communities are taking what often has been a very fragmented or loosely organized set of resources and bringing them together in a way that allows a community to really assess what resources exist across the community, where there are some gaps, and how they really are going to be able to target and prioritize populations based on assessment of need, and then also based on what resources they really have. All right, so this is one of my favorite visuals because I think it just, for many reasons, I think we kind of smile when we see it. This is the very easy to read federal framework to end homelessness. And leave it to the feds to come up with something like this. But I also think at the same time, it's rightfully complex, because youth homelessness is complex. And it does a nice job of showing us that there actually are a number of milestones that we are going to have to get to, just as young people have a number of milestones as they are developing across the course of a lifetime. And so the way it's organized, the top part is our data strategy and the bottom part is our capacity strategy. And by data strategy, we're talking about the research. What is it that we know about the characteristics of youth experiencing homelessness? What do we know about the prevalence of youth experiencing homelessness? We know that it looks different for youth. Some youth are going to be literally homeless in shelters. Some youth are going to be housing unstable. They're going to be couch surfing. So we recognize that there are various definitions of homelessness for youth, and altogether, they tell us about the picture and the landscape. We also know that part of our planning is informed by the research. And so as we begin to think about the interventions that are most appropriate for youth, we have to look at where are those youth coming for services. At this point, we would consider ourselves to be, I would say, somewhere between phase 1 and phase 2. So if you look at the very beginning, we've got June 2012. That's where we launched our youth framework. It was built on the limited knowledge that we had at the time. And over the past several years, communities have done a lot of work on the ground to increase their local point-in-time count. There are increased collaborations with schools, between schools and the youth providers to really get a better sense of where those youth are and what their experiences are. We also have a number of research projects that are underway. Most notably, Chapin Hall is launching their national prevalence study. And I think that is going to be the most significant research project that will inform this work. At the same time that we're working on gathering data, we're also building our capacity. And that means that's the work that's happening locally on the ground. Those are the communities that are developing their statewide plans, like here in Connecticut, but it's also the community providers that have interventions for youth that are coming to their doors. And it's the federal partners beginning to learn about what are those examples of best practice. So a couple of things have been happening in the last few months. One, the National Alliance to End Homelessness has been convening youth providers from across the country. Our first convening was back in the fall, and that was looking at providers who are serving youth under the age of 18 and beginning to identify what are some of the interventions that providers are using in urban settings as well as rural settings, because we also know that youth experiencing homelessness in rural areas are going to have different needs. They're also going to present differently. So we've talked about different interventions like the use of host homes as being an alternative to some areas that may not have a youth shelter. We also have now started to pull together providers that are serving the 18 to 24-year-old group of young people, because we know that those youth also look a little different than our younger population, and there's some additional complexity. There's a large portion of those youth that we know that are pregnant or parenting. So they start to straddle both a youth provider and a family provider, which brings additional complexities. We also know that for those youth that are child welfare involved or involved with juvenile justice and then are hitting that threshold of aging out, they again trying to figure out where do those youth fall and how can we collectively bring systems together to begin to invest in services to meet the needs of those young people. So this really just summarizes the visual, and it's a great way, I think, if you're wanting to really understand the federal framework, it's just breaking it down into two strategies. It's getting to better data, which we are, and then at the same time, we continue to build our service capacity. And so I think the question often comes up, well, why one single intervention model? And I think it's important to remember that for the federal framework, we're not talking about one single intervention model. We're talking about an intervention model that brings together, I think, a lot of the common principles, because we know that on the ground, there are a number of different evidence-based practices that are going to be effective with youth, and that each youth requires an individualized or tailored approach to services. But what it does do for us is it begins to have us think about approaching this work in a more coordinated and cohesive way. So rather than having providers who may serve one particular kind of youth, that they are able to then bring together their resources with other programs, and I think collectively they can begin to look at what are the programs that we have? Who's best suited for our programs? Because one program may have really great expertise in serving pregnant and parenting youth, and perhaps not so much with a young adult male. And so as we begin to bring these programs together and they can start to look at the services they're providing, it helps for matching and actually targeting youth. Which then brings me into the discussion of coordinated entry. This slide is really just to show the outcomes that we're trying to achieve and that they all are really connected, right? So that you can't have permanent connections without well-being. And that if you start to impact any one of these, you are going to have a ripple effect across all of the outcomes. Vulnerable subpopulations of youth. We know that even amongst our young people, there are increasingly vulnerable youth. This is just a snapshot. I would say on this list, we should be adding our youth who are experiencing human trafficking and those who are being sexually exploited. We know increasingly these youth are more vulnerable, not only once they become homeless, but in that experience of being homeless, they become even more vulnerable to negative influences and behaviors. All right, so what are we doing now on the federal level? I want to just touch back on coordinated entry, which I think many of you are probably becoming more familiar with, and if not, it's coming, you will be. The local continuums of care are required by HUD to implement coordinated entry systems. What that means is communities are bringing together all of their housing resources and beginning to centralize how individuals access services. And this is related to being able to really think about targeting and prioritizing service delivery. What's critical here, though, is that it cannot happen in the absence of connections to mainstream programs. And over the next few months, there will be a series of briefs coming out from HUD that are really giving additional guidance, both to the continuums of care as well as to mainstream programs, on how those connections can and should be made. And I think this is particularly important for young people. In the District of Columbia, we've started coordinated entry. I think for us, it's probably a little easier because we are a much smaller jurisdiction. So you're only talking about 4 or 5 providers. But even bringing those 4 or 5 providers together to the table, and then bringing juvenile justice, and then the schools, and then child welfare, and then mental health, has been really challenging. And this is even within an environment where there's a lot of political will and support for this kind of cross-system collaboration. What it's done is it's really allowed the providers to look very closely at how they are delivering services and really beginning to systematically organize themselves in a way so that no matter which provider a young person touches, there's actually a common assessment tool that they're using. And then every day at 3 o'clock, the providers all get on the phone and they go through their list of which youth presented for services, and they determine who has a bed and which would actually be the best fit for that young person. So since January, they've assessed about 40 to 45 youth. Of those, they found that about 13 have had contact with child welfare. And so what we are doing now is digging a little deeper to find out, are these current open cases, are these former cases, and then if they, depending on where they land, what is the role of child welfare? And so this is a conversation I think that's going to be ongoing. The other piece is looking at the financial investment. And within the district, as with many states, there's a local system of care. So part of the conversation is, how can we begin to bridge the connection between the housing resources and the local systems of care, which have already begun to organize themselves, including looking at financial sustainability. And so this is a real opportunity, I think, not only in BC, but in many communities, to begin to think about how you can bridge and connect with those child and family serving systems in a way that allows for both resources and the actual provision of services, so that it's not simply the targeted homeless assistance program or the targeted runaway and homeless youth program that's providing all of the services for this population. So on the federal level, our #1 deliverable this year is our report to Congress. We are required to submit a report that really walks us through how federal programs that are serving youth experiencing homelessness can better coordinate. For us, we feel that's a pretty narrow scope. We actually are going to take it and expand that to all programs that are serving youth. I'm getting my time, so I'm going to quickly run through these. Just the bullets are some of our key initiatives. We are integrating runaway and homeless youth program data with the HUD Homeless Management Information System. This is the start of being able to cross-match and identify which youth are being served where. I mentioned under the WIOA, there are opportunities for young people. I'm going to jump to the planning grants. These are 18 planning grants across the country that are seeking to identify how we can better target young people who are in foster care, who are most likely at risk of homelessness when they exit. And so those planning grants are going to be wrapping up this year, and phase 2 implementation will roll out in the fall. We have launched 2 homeless prevention initiatives, one in Houston, one in Cincinnati, and these are focused on LGBTQ youth who are at risk of homelessness. They are looking at the kinds of resources and interventions that would support families, because we know for many of those young people, that's where the disconnect happens for them. The budget, I wanted to definitely touch on the budget. I think for us, this shows the significant commitment and increase in resources, a little different than what we've had before. Over $5 billion in targeted homeless assistance, and that's in addition to the investments in mainstream programs like Head Start, like Title IV-E. So I'm going to stop with that. Sorry I had to rush through. I think we'll have a chance for questions at the end.
Thank you, Jasmine. That was wonderful. We actually have time for about 1 or 2, maybe 3 questions right now before our keynote gives her address. Does anyone have any questions for Jasmine right now? No one had their coffee this morning.
Can you just repeat where the coordinated access system for youth is identified, for reporting youth?
That's the district of Columbia.
Can you make the PowerPoint available?
Yes, so that's a great point. All of the materials from today's presentation will be available on our website, and we'll send the link out to all of you after the event so that you can access things. Any other questions? All right, well, thanks again, Jasmine. We appreciate you traveling from DC to cold Connecticut to be here today. So next, I want to introduce our keynote, Beth Bolger-Ambrose, who traveled all the way here from Minneapolis, Minnesota to be with us today. Beth currently serves as the Executive Director for the Link in Minneapolis. Prior to this, she worked as the Homeless Youth Services Coordinator for the Minnesota Department of Human Services, their Office of Economic Opportunity. This position included administration of federal and state funding streams, public policy and legislative work, research evaluation, program development, and the coordination of services for runaway homeless and sexually exploited youth in Minnesota. So, a warm welcome for Beth Bolger-Ambrose.
Well, thank you so much. I'm so honored to be here today to talk about the work we're doing in Minnesota, which is by no means finished. We still have a lot of work ahead of us. But I'm very excited about all of the committed people here to supporting young people who are experiencing homelessness. It's really inspiring to see such a full room for that. And I also want to thank Elizabeth and all of the people that helped me get out here. So to share this with you, and also I've already learned some good information from all of you staff and experts here as well. So I will go ahead and talk a little bit about what we've done in Minnesota. It's been a long road with a lot of work, and like I said, we have a lot more to go. But first I want to kind of explain who I am. I actually have an interesting career trajectory, so to speak, because I started out in the late 90s as a street outreach worker and case manager with runaway and homeless youth through street outreach, emergency shelter, and transitional living programs. And so I had worked in direct service with young people for quite a while. And then the state of Minnesota was hiring for our homeless youth services coordinator position. And so then I applied thinking, I don't know if I'll be the right fit or what they're looking for, but they did end up hiring me. And so I worked there for 7 years. And that was really a lot of our work, implementing the Homeless Youth Act, which is what I'll be talking about today. And then right now, I have my dream job, which is the executive director of an organization called The Lynn, which I'll get into just a little bit here. We are a nonprofit organization that was started 23 years ago, actually by 2 former Minnesota Vikings, Jim Marshall and Oscar Reed, who responded to a need for at-risk and homeless youth on the north side of Minneapolis, which is one of the most impoverished areas of Minneapolis. And so instead of fishing or golfing like usually former NFL players do, I'm guessing, they decided to dedicate the rest of their careers towards helping young people, and they're still very supportive of our organization. We have 3 different divisions, so since that time we've grown a lot. We have a juvenile justice division, which includes basically alternative programs for youth who are between the ages of 10 and 17 who are either involved in or at risk of becoming involved in the juvenile justice system. And so our largest program within that area is a program called the Juvenile Supervision Center. It's open 24/7, where any law enforcement within Hennepin County, which is the county where Minneapolis is located in, can drop off youth for low-level offenses, status offenses, or felony car theft. For some reason, we can take that one felony. And then our staff basically work with the young people from a positive development approach versus a criminal justice one. We do a lot of homeless prevention work in that program, as you can imagine. We also have 145 units of housing within our Housing and Homeless Youth Services Division. And so we have 5 housing programs. Some of them are rapid rehousing, and some of them are supportive housing, and some of them we have 2 congregate site facilities, and we have 3 programs that are scattered site, one of which is dedicated to young families, with 26 of those units being for young families who are parenting. We also have a safe harbor division, which is our state basically passed a safe harbor law in 2011, thankfully, which decriminalizes sex trafficking and prostitution offenses for youth under the age of 18. We would have liked to see it go up to age 24, but that was what our legislature could kind of stomach. But we're keeping to work on it. And basically through that, the Link is a partner in that we've opened up the emergency shelter and housing program specialized for sex trafficked youth called Passageways. And then we also have the West Metro Regional Navigator, which acts as a centralized point of contact for sexually exploited and trafficked youth within Hennepin, Scott, and Carver counties. And then we also have a variety of supportive services, both for the youth that are living at Passageways, as well as sexually exploited youth that may not be living in our shelter or housing program. So today I'm here to talk about mainly the Homeless Youth Act, but I wanted to kind of explain a trajectory of what I'll be talking about, which is I'll explain the background and the work that kind of went into getting the law passed, as well as the strategies we used, the bill language I'll go briefly over, and then also our implementation, the additional programming that we did in Minnesota to kind of bolster our Homeless Youth Act, as well as outcomes. And then there will be time for questions at the end as well. So back in 2001, which was a long time ago, although in some ways just seems like yesterday, a group of us really worked on drafting the Minnesota Youth Runaway and Homeless Youth Act. And originally, I want to give credit to Rich Hooks-Wayman. He now lives in Massachusetts, but at the time, he was the executive director of our Streetworks Collaborative and also worked as the head of the Minnesota Youth Services Association, which was basically at that time a group of homeless youth providers that were advocating for our Homeless Youth Act. And what he did was he helped to draft and then get a group of us together to really work on putting together Minnesota's Runaway and Homeless Youth Act, now known as just the Homeless Youth Act. And it was originally part of a much larger piece of legislation called the Minnesota Youth Advancement Act, which had different sections. So the Runaway and Homeless Youth Act was one, but then there was other sections around improving child welfare and improving juvenile justice. However, what the group kind of decided at the time was that was way too much to take on at one time, and so we just narrowed our focus, although we haven't forgotten about the other 2, and there's definitely efforts going on to improve our juvenile justice and child welfare system. But at that time, we chose to just focus on the Runaway and Homeless Youth Act. The interesting thing about this, I will say, is that having worked in government, I think what makes our Runaway and Homeless Youth Act unique is that it was written by runaway and homeless youth workers and the homeless youth community. And so it was written in a very flexible way. The population that is defined makes total sense. There's no, you have to have a purple thumb with the right hand to get into a program. I mean, it's very, very, and I'll get into it more later, but it was written intentionally that way by the people who were working with homeless youth, and there was actually homeless youth sitting at the table giving their voice to this as well. So because of that, we have a very, really good, I feel like, Runaway and Homeless Youth Act law in place because of that. And it wasn't, any kind of government mandate to do this. It all came from a grassroots organized effort by the homeless youth community. So this was the hard part. So because we had no Runaway and Homeless Youth Act, and there wasn't really any presence of funding or laws that were around, supporting runaway and homeless youth in our state before, we were starting from ground zero and had nothing. And so it was a really tough, I will say a tough fight to get it in. We went to the legislature for 5 years and didn't get it passed for 4. And then after 5, we got the Runaway and Homeless Youth Act finally passed in 2006. So we all learned a lot. I especially learned a lot during that process of how laws are passed, how government works, all of those types of things. And so our law is actually called, or the statute is 256K.45, and we'll give you a link to that either through the website of the organization that's sponsoring this, Partners for Stronger Communities. And basically what the law did, it defined 3 things. It said, here's what, the population, so it defined what a homeless youth was, what a at-risk of homeless youth was, and what a runaway was. Again, these were defined by the community. It also defined a continuum of services for all the way from homeless prevention to supportive housing and everything in between, which I'll explain. And then last but not least, it, of course, required the Department of Human Services to do legislative reports on runaway and homeless youth in Minnesota because, as Jasmine was saying, us in our state, we didn't have good data either. So we wanted to mandate that something was done about that. So these are the 3 kind of areas that our Homeless Youth Act covered. So fast forward a little bit. So in 2006, just the language passed. It was not a funding year at our legislature, so only the language passed. Then in 2007, we continued doing our grassroots campaigning of our legislature, and we were able to get a $1 million commitment. But there was kind of a little caveat to that, said, oh, it's a one-time allocation. So it wasn't in our state budget line item permanently, it was just a one-time allocation. So, but we were all excited and running around like we won the lottery because it was the first time that our state had dedicated any resources specifically for runaway and homeless youth. So then what happened was, around that time, I was actually had gotten my job at the Department of Human Services as a homeless youth services coordinator. So then I switched gears from being a homeless youth direct service provider and advocate on the ground level for the law into the person that basically wrote the request for proposals and administered the Runaway and Homeless Youth Act program. So it was a good switch, and it was, I will just say, an incredible learning experience and one that I loved, and I think it really helped shape my understanding of how government and nonprofits can work really well together. So basically what happened was the funding was placed in our Office of Economic Opportunity, which in Minnesota, we do have a Minnesota Housing Department. However, our Minnesota Housing Department only does capital and bricks and mortar type of funding. They don't do service funding. So our homeless service funding is within an office called the Office of Economic Opportunity, which is actually within our Department of Human Services, but it's completely separate from our child welfare system. So our child welfare system is in an entirely different division of the Department of Human Services, and I'll explain more why it was housed that way throughout my presentation. So in 2009, what happened was, if you remember, we had a one-time $1 million allocation, and then there was the brutal reality that wasn't going to happen again in our next funding cycle in 2009. So we were back at the advocates were back at the Capitol at that time. I was on the inside of DHS trying to really get something in there. And so what ended up happening is we were allocated $238,000, which over 2 years, so we kind of called it a rounding error, but it was at least something that was within our state budget line item dedicated to runaway homeless youth. So it was at least something to get us in there. Then between 2009 and 2013, we kept at it. I was at DHS at the time, so I was working internally within DHS and coordinating well with the advocates on the outside, and so we were both kind of pressing like this. And then in 2013, we were able to get an incredible feat, which is we were able to get $4.238 million over 2 years. So we went from just almost nothing to a little over 4 million. So we are very, very happy. In 2014, there was a supplemental budget, and so we were able to get an additional 1 million. So actually today it sits at $5.238 million for 2014 to 2015 state fiscal years, which is what we're currently in. And I will explain how we're working for even more later in the presentation. The other thing that happened was we had some legislators that were kind of opposed to, or there was some politics around the word runaway, like, oh, well, if they're running away, can't they just go back home? And we all know what that means here. But basically what we said was, okay, fine, we'll still serve runaway, but we'll change the name of the act to the Homeless Youth Act. So we changed the name to just say the Homeless Youth Act, kind of because of that, but we still can serve runaway youth and at-risk youth within it, because those populations are still the same. So what was the difference? What made it go from a rounding error to an actual sustainable program for runaway and homeless youth in our state? What happened was we had finally gotten the Senate, the House, and for the first time the governor's budget. At the same time, we had, I want to say, consistent leadership within the House, the Senate, and the governor's office, so they were all Democrat, so they were able to kind of get along a little bit better, so to speak. But in addition to that, we just really, I feel like over time, had built the case for needing additional funding. We had a lot of hard work that went into it year after year. But it also really helped that we had that kind of more of an alignment within our state legislature as well as the governor's office. So then the other thing I'll talk a little bit about, but this is a very special person. His name is Derek. He's actually from rural Minnesota and experienced homelessness and was in our state, our support systems for rural homeless youth program, which I'll talk more about later. But he came out as well as several other youth that testified before the House, the Senate, and our governor about the importance of runaway homeless youth services. And what was really neat was he happened to testify the day it was our Minnesota Coalition for the Homeless Advocacy Day on the Hill, so the hearing room was packed. And so he was up there testifying in support of the Homeless Youth Act and talked about his own experience as being homeless. And then afterwards, everyone, which I've never heard in the House before, but everyone started clapping and cheering. And so it was really neat, and the legislators that were in the committee had to tell people that, clapping is not normally appropriate at hearings, but everyone was so excited and moved by his testimony. There was people cheering, crying. And so the other thing that happened was when we got that $4.238 million allocation from our legislature, what happened was the governor, this is Governor Dayton, our current governor of Minnesota, at that time in 2013, he had a reception for all the homeless youth providers and state administrators and people like that, kind of celebrating the passage of this additional funding. And so then, of course, I asked if Derek could get a picture with him because, and his case manager, Kathy, because he, I feel like, had a really great testimony in support of this. So this is him in the governor's office with the governor after we got that $4.238 million in the budget in 2013. So how did we do this specifically? Because we get asked this a lot, like how did it happen? And I want to say for sure it didn't happen overnight. So you remember we started in 2001, it's now 2015. But basically what we did was, again, I can't stress enough that the bill was designed by service providers and youth. It was what we did was, in terms of an ask, we put our heads around what it would cost to provide services, like what was needed to enhance our state capacity of current providers, as well as what it would take to basically build up programming in areas, especially rural Minnesota, in suburban areas that didn't have any programming at all. And back in 2001, we came up with $8 million. So, and that, right now, we changed it, we're, with inflation and everything, to $10 million because it's 2015. So we have upped our ask to $10 million from $8 million. This, of course, doesn't recognize, this of course recognizes that the state's one player. We also have federal funding, county funding, private foundations, faith-based, etc. But this would be the state, what we think is the state's fair share of what's needed to operate a better continuum of services for runaway homeless youth statewide. The other strategy we had, like I said, was that I, as the homeless youth services coordinator, was on the inside, working hard within DHS to promote this to our commissioners, doing the bill analysis, being at the, supporting all the legislators' questions around it, and working with, providing information, public information, of course, to our lobbyists and key stakeholders so that they could do appropriate advocacy on the outside. And so I think that coordination between the state office and the local community advocates was really important. And I fortunately went into my position at the state with really, really strong relationships and trusting relationships with community providers because they knew that I had come from the front lines. So the other thing I get asked a lot is why combine with homeless and adult family services? So what happened was when we first got our Runaway and Homeless Youth Act, there was a question about, well, should we put it in child welfare? Should we put it in, housing? Well, that's just capital. And so it was decided that we would put it within the Office of Economic Opportunity with the other homeless adult and homeless family services funding. And I'll kind of explain why we did that. The first thing, I think the primary thing is just that that office happened to know a lot already about street outreach, drop-in centers, emergency shelter and housing programs. So what was happening was they had that knowledge versus our child welfare system did not and does not. They're traditionally probably like yours or many other child welfare systems is that they specialize more in the child protection end of screening, assessment, and those types of services, not actually operating housing or emergency shelter or services that support runaway and homeless youth. The other thing was that there was a huge knowledge of why people experience homelessness and just a lot of extensive knowledge of the homelessness issue within the Office of Economic Opportunity, where it is not in the child welfare system. The other thing was it was a request by the homeless youth lobbyists and homeless youth community. They knew that the Office of Economic Opportunity was transparent about how they did grant making, that they worked well with the community providers, based nonprofits, and they also felt like this was the right place for that act to be placed in. And so actually our lobbyists talked to the Senate and House authors and said, we want this money to be placed within the Office of Economic Opportunity. We do not want it in child welfare or anywhere else. This is the right place for it, and so that's where it landed. And so it really came from, honestly, the community's request because of all of these reasons to be placed there. So it also in Minnesota really are, although child welfare and juvenile justice and children's mental health are important partners in the work with youth homelessness, especially with those youth who are transitioning out of foster care and are at high risk of becoming homeless, they weren't the appropriate option for the Runaway and Homeless Youth Act to be housed under. So again, I repeat that none of these systems are designed or have the capacity to serve homeless youth. In Minnesota, homeless youth are a mandated report into child protection if you're under 18, but they're not getting served. And so none of these systems adequately, I'm not trying to blame any system or anything like that, but what I will say is that they're just not the adequate system to support these young people for many, many different reasons. And youth will definitely tell you that too, youth experiencing homelessness themselves. Also, these systems lack the capacity and knowledge of how to transition youth out of homelessness into stability, whereas our runaway and homeless youth service providers, that's their expertise. They know exactly how to do that. These systems also don't have the expertise to provide 24/7 emergency shelter and housing. For those of us that have worked in 24/7 emergency shelter and housing for minors or young, older youth, we know that that's a whole different ballgame than placing a youth in a foster care home or something like that. I feel like a very amazing work, and I love it, and that's why I'm in it. But it's also very challenging, and you have to have a special kind of expertise to be able to administer those types of programs. Last but not least, youth experiencing homelessness in Minnesota tend to be very distrustful of systems and work better with community-based agencies. We just found that that's just a better fit from what the youth want themselves. So again, these systems, I'm not saying they're off the hook. They're definitely good partners in the work, but they're just not the right system to be the main provider for youth experiencing homelessness. I also should say one more thing that I don't have on the slide. It's just that there also was a concern from the community advocates that if the Runaway and Homeless Youth Act was placed within the child welfare system, that only youth who had been aging out of foster care would be served by the money, versus the whole expanse of homeless youth, which was what the law was intended for. So that was another underlying concern that wasn't necessarily fully stated, but they were very worried that that would happen, and then that would actually cut out the very people that the law was intended to serve. So there was a lot, like I said, of grassroots efforts in terms of working to get this law passed. And so, first of all, we had, at the same time, a very fortunate experience of Wilder Research and Twin Cities Public Television that wanted to do a documentary about youth experiencing homelessness. It was the first time I'd ever been involved in a documentary like this, and so myself and a youth that I had worked with, a former client, as well as several other young people, were interviewed for this documentary, and it was really actually done really well. The youth were able to review their own taped comments and be able to comment on what they wanted left in, what they didn't. And so that was actually airing a lot on Twin Cities Public Television. People were playing it at different community events. And so it really raised some awareness and in a very respectful way brought the voice of youth homelessness out into the community further. Also, we have a Capitol presence, and we're actually still doing it. The Links Day is this Thursday, actually. We're bringing youth down to the Capitol. And basically what this is every Thursday during the legislative session, starting way back, the homeless youth providers take a turn of each getting assigned a Thursday at the Capitol. And what that means is we go in and we get trained from our Youth Moving Forward group on how to lobby. And the Youth Moving Forward group is kind of our Minnesota Youth Service Association now in 2015. And that group works to advocate for the Homeless Youth Act and reform the child welfare system. So they train us, and then we go around and meet with all our different legislatures and explain basically why we want to support the Homeless Youth Act. So it's a mix of our staff and young people that go to this. We also have youth testimonies. So I talked about Derek's testimony. So we definitely have young people that go and testify. We do not want to exploit youth, however, so it's only youth that have aged out of the services, of the homeless youth services, and who really want to publicly do this, and it's empowering for them. We never force any youth who is currently in our programs to do something like that. We also had executives from Lutheran Social Service, Catholic Charities, and Wilder really get on board. After the Runaway Homeless Youth Act kind of got bigger, especially in 2014, they really got on board and started showing up at the Capitol for these hearings and doing some testimony. And their voices really helped because they're much larger organizations within our state, and they're statewide. Also, we had an art exhibit by Culture Club, which is art that's designed by youth experiencing homelessness, and so there was an art exhibit with their art at the Capitol, and that, for actually 2 of the years that we were advocating, and so that helped just again bring about awareness. We had more media coverage in recent years than we have had in the past, which also helped greatly. We had a lot of people writing letters to the editor, kind of trying to get press releases out about this topic. And then we also invited our legislators to come and tour our homeless youth program so that they could see firsthand what it's like, what the emergency shelter or basic center, as they're sometimes called, what they looked like, how the housing programs work, etc. And that really, really helped. So we set up actual tours between our youth programs as well as some of the adult and family programs that really showed them firsthand this is what it's like. And they would even go to some of the shelters when people were lining up outside the door or when they were doing the lottery or things like that to see this is how many people there are that need help, and this is what it looks like when you have to turn them away. So in terms of the bill language, because of time, I'm going to just go through this really quickly, and you can again read this bill language for yourself. So basically we defined at this time a homeless youth as someone 21 years of age or younger. In addition to trying to get $10 million funded for the Runaway Homeless Youth Act, we're also raising the age to 24. So just so you know, that's actually it passed out of the House and Senate this legislative session. So when our session adjourns in May, the end of May of this year, we expect that our Homeless Youth Act will actually go up to age 24, which will be great. Keep in mind, this was written initially in 2001 when we didn't have all the research about adolescent brain development. So now we just want to update that and get the age higher in there. So we just kind of define in here what a homeless youth is. Also, we have in there someone who lacks a fixed, regular, adequate nighttime residence because we know a lot of youth go out shopping and things like that. And so because of that, we defined what that meant. And so it means, somewhere that's either a supervised publicly or privately operated shelter, a temporary placement with a peer, friend, or family member that's not offered permanent residence, or a residential lease, or temporary lodging for more than 3 days, or a public or private place not designed for human habitation. So I'm sure you've heard all of the stories about young people, how they're trying to survive, but we wanted to make sure that it included all of the people, not just the youth that were aging out of foster care, not just this particular population, but every youth who's experiencing homelessness. Youth at risk of homelessness, we also defined. And so we said youth at risk of homelessness basically has to have facing a significant danger of experiencing homelessness in the near future. Now, how does that define? You probably want to know. We defined it as this. So basically kind of wrote out what we felt like was a youth who is at risk of experiencing homelessness. We also defined the continuum of services for youth. And so one of them was street and community-based outreach. And again, I won't go through every definition, but I'm assuming most of you are familiar with some of these if you're from the homeless arena. These are the services that street and community outreach were defined as applying or as being. Drop-in centers, emergency shelter, supportive housing and transitional living programs, which in our state can also include host homes, just as a FYI, I won't use those here, but it can be congregate, site programs, it can be site-based, scattered site, or host homes. Yeah, so basically it went through the whole continuum, and it just defined what they were and also what services could be provided, examples of services that could be provided, but it's not a laundry list. There's other ones that kind of says it's not limited to, which is really nice. So again, fully written by the community, and so it makes a lot of sense. So the implementation, now the second phase. So it's really tough, to get a lot passed and to get funding allocated, but then it's also tough to make sure it's implemented in the right way. And so basically what ended up happening was when I was at OEO, we wrote a request for proposals and then had a bidders conference. And so what we did during that time was we actually also, prior to doing that, had a focus group meetings with homeless youth providers to get their input into how the RFP should be written. And what was found was that they didn't want, there was some political pressure to say, oh, you need to designate this much for housing, and this much for street outreach, and this much for prevention. Well, the homeless youth providers didn't want it like that. They wanted the full, $4.238 million at the time to be allocated just flexibly, because we didn't know how many requests we would get for what and what the exact needs were yet, since it was the first time doing it. So to this day, the Homeless Youth Act can fund anything from homeless prevention all the way to supportive housing, and there's not like a designated target for each area. We base it off, that office bases it off of what the applications come in as. So at any rate, so our request for proposals was written, and there was a bidders conference to answer questions. And then there was a review committee that, once the applications came in, that basically was made up of state officials from different departments. And mainly they were made up of officials from our state's interagency task force on ending homelessness, which is led by Kathy Tenbrook, our statewide director. And so those staff members reviewed and scored applications. Also, myself, I was the Homeless Youth Services Coordinator, so I oversaw this whole process and also provided ongoing, after the grants were made, technical assistance to help new organizations begin, and develop, as well as help and assistance for large and small organizations that were first getting this funding. And then I got the pleasure of writing my first big legislative report, and I've written a few since then to the legislature about, I actually have forwarded all of this information onto Elizabeth, so if you're interested, you can get a hold of those, just on the prevalence, basically, of runaway homeless youth in our state. So data collection, everyone wants to know about this part. How do we collect data and outcomes for the Homeless Youth Act? We basically, most of our providers, not all, were already using the Homeless Management Information System as required by HUD. And so we actually used HMIS for our shelter and housing grantees to enter in their data and outcomes. Now for street outreach and drop-in center, I decided not to require HMIS at that time, only because street outreach encounters and drop-in center encounters are so brief with youth that you can't really do a full-scale HMIS and outcomes assessment with them. And so what we did was more of a tallying of numbers served through an Excel spreadsheet, which I know isn't as fancy, but what would have happened in our state if we required that is the outreach workers would probably spend more time entering data into HMIS than with the youth, and we didn't want that to happen. So that's kind of what we did at that time. And it's still operating like that today. Also, it required, we did an annual report. In addition to that legislative report, we did an annual report of all housing outcomes combined within the Office of Economic Opportunity to the legislature each year. So we combined like homeless adults, families, and youth all into one report to let our legislature and key stakeholders know how we were doing. So the other thing that happened was when we got the increase of funding, when we got that $1 million allocation back to 2009 now, we also were required, in addition to a legislative report, there was a very small amount of money, $30,000, dedicated to a Runaway and Homeless Youth Act evaluation, because the legislature really wanted to know if there was a need for further funding, which hopefully helped us get that rounding error money, that $238,000, that led to larger funding later. And basically what we did, I spearheaded this project when I was at DHS, and so we decided to include youth voice in the process. So we did use information from our HMIS that we had been gathering from providers as well as the Excel spreadsheets. But then we also did, and people at the state thought I was crazy, but I did 19 homeless youth focus groups, a focus group with each provider underneath the Runaway Homeless Youth Act, so that I could get their feedback from the youth directly on how narratively they had experienced the homelessness programs, how they helped them, etc. And so we combined the narrative feedback from the youth with the HMIS data, and we also did provider interviews and surveys with the Homeless Youth Act grantees. And we combined this all, and again, wrote up a beautiful report, the Runaway Homeless Youth Act evaluation, which again, you can contact Elizabeth for. But that was done, and then we had a, once that was completed, we had a Runaway Homeless Youth Act evaluation release event. I first was calling it a release party, but then our marketing person, or communications person at DHS said I couldn't call it a party. So basically it was a, it was a Runaway Homeless Youth Act evaluation release event. And there's a lot of people that attended that, and so I presented the findings along with one of the partnering researchers. So that's me with a different hair color. Yeah. And so basically, and we had cake and food and a lot of youth. We tried to make it as youth-friendly as possible within a government agency. But it was a great event, and it attracted a lot of attention, which was good, because I think this also probably helped raise awareness about the issue of youth homelessness and us getting further funding in the future. And the findings from that, I will say, I mean, I can't go over all of them today, but I can say they were overwhelmingly positive, was the experience that youth had had within the Homeless Youth Act programs, as well as the outcomes that were reported at HMIS. So, in addition to the Homeless Youth Act, what happened was we decided, I was really trying to figure out, okay, how can we leverage more resources for homeless youth within the state systems besides just the Homeless Youth Act? And so I worked with a lot of partners to kind of try to identify other opportunities and to do this. So I'm going to speak to that a little bit. So what happened was, and some of it was luck and some of it was strategizing work. So part of the lucky thing that happened was there was an announcement from ACF, Family Youth Services Bureau, out of the Federal Department of Health and Human Services, that put out a pilot grant for states to develop rural homeless youth programs, and they were calling the pilot Support Systems for Rural Homeless Youth. They were 5-year demonstration grants for $1 million, which basically were given to states to help develop services for rural homeless youth. And I said, in my application, I called up someone and said, can we apply for reservations? Because in Minnesota, unfortunately, American Indian youth are overrepresented within the homeless youth population, but we have no services on reservation. We have 11 reservations and none at homeless youth services. How horrible, right? So basically, they said yes because they, fit the population. They were smaller. They had a community smaller than 20,000 people, and I was like, no problem. Our reservations are pretty small, population-wise. And so then I worked with Boys Fort and Leech Lake Reservations in Minnesota to write an application, and then we were funded, and so we developed support systems for rural homeless youth, which were the first transitional living program and homeless youth programs in our state in Minnesota. And how we did it was we got basically like a committee, both of state agency folks from different agencies, as well as, which included Department of Education, and we invited child welfare as well. And then we also had youth. 50% of the committee were youth consultants, and they were paid as consultants should be, from Boys Fort and Leech Lake Reservations, and they basically helped to design this program that would eventually serve them. We also had, so that program is still running on Boys Fort and Leech Lake, even though the pilot funding is ended. We were able to support them through the Homeless Youth Act funding to continue the housing pieces of that. Rural Homeless Youth Project, this was kind of after this happened, a local foundation called the Otto Bremmer Foundation approached me and said, hey, we hear about this rural homeless youth work you're doing. Can you do kind of like a study or a finding on what the needs are in different rural homeless youth communities and tribal communities, again, reservation communities across the state? I said, sure. So we ended up doing a Rural Homeless Youth Project, which produced a report on rural youth homelessness and reservation youth homelessness to our state legislature, and also it helped funders and things like that. Because we were getting that big increase the same year I was doing that project, we went out and asked the rural communities and tribal communities how they would want to see the Homeless Youth Act investments being made in their communities, and so we were able to get good feedback through that as well. Then, and for that project, I of course hired Youth Experiencing Homelessness to help me co-lead it, and so they would help me co-facilitate the focus groups and the writing of the questions, and they were incredible. We also, in 2011, passed the safe harbor law. So for years, I don't know if you're familiar with safe harbor laws, but basically it was modeled after a law in New York that states that youth under the age of 18 should not be criminalized for prostitution offenses. And so it should be treated as victims versus placed in juvenile correctional facilities. And so for many, many years, those of us in Minnesota were frustrated by the way that sexually exploited youth were being, treated and incarcerated and things like that. So we were able to pass this law in 2011, and then it was implemented August 1st of this year, of 2014. And so we now have a whole new response, which is a whole other presentation, but I can get you the overview of that if you'd like, and it's called the No Wrong Door response. We also had another this was kind of a lucky thing. So basically what happened in 2009 was the Family Homeless Prevention and Assistance Program, or FHP PAT in Minnesota, doubled from 7.5 million to a little over 14 million. At that time, I sat on the interagency task force at the state still, and basically encouraged the colleagues on there to have a youth priority or youth focus, because youth were not being served under this funding stream well at all, and it's mainly for prevention services. And so we were able to get a youth priority and develop homeless youth prevention programs through this funding source as well. And a lot of times I publicly wouldn't go up running around saying these things, because then people would say, oh, we don't need to fund the Homeless Youth Act, right? But so you're building up all piece by piece, all these different systems we needed. So it was a lot of work and a lot of strategy. Last but not least, we have a Metro Youth Systems Redesign Council that's looking at our coordinated assessment, or now called coordinated entry process, and we're trying to create a 7-county metro-wide youth coordinated assessment process specifically, because we know that county by county and different continuum of care regions, youth kind of cross those lines, and so we want to try to have a more coordinated youth approach in the metro area. So I'm going to quickly go through these just for the sake of time. This is just more information about our support systems for rural homeless youth programs. So like I said, it was $1 million allocation over 5 years, and we did have, it was definitely, there was representatives from all the different state departments on that, which was really great. And then I brought in the concept of youth consultants to the state for the first time. And again, they were like, what are you doing back here in youth? But then they loved it. My boss was like, this is genius. They have great ideas, so smart. We should always develop statewide youth programs with youth voice incorporated. So it was really good. And now to this day, thankfully, we have housing programs on Beach Lake and Boys Fort reservations as a result. This was, again, just more information about the Rural Homeless Youth Project. And this is a picture of our Rural Homeless Youth Program on Boys Fort Reservation. So the youth were doing an activity, culture-specific drumming and music activity with their case manager. And I happened to be there that day and asked if I could take pictures because I thought it was so cool. Safe Harbor, No Wrong Door, I spoke to a little bit, but I just want to say that there was a committee, of course. Every government law has to have a committee or initiative, right? So there was a No Wrong Door committee that was formed to basically develop a new response for sexually exploited youth. And so it was led by an interagency group between public safety, human services, and health. And I was the human services representative of that. And then since that, when the act got implemented, I had already moved to the link. And so this is just a picture of when we opened passageways. And again, we had a survivor advisory committee kind of help with that. So the youth, they each have pieces of the ribbon. They were really excited. They named the program, developed it, helped me figure out rules, still help oversee it. And we also have other youth advisory committees at the link. I can't stress that enough. As you're developing homeless youth programs, to have a youth advisory committee is great. Plus, it's really fun. And then the FHPAP Youth Focus I talked a little bit about. So that was it wasn't a legislative fix, it was more like me talking to the colleagues and being at the table, and speaks to the importance of having someone representing youth issues on all of these statewide big homelessness committees, because then you can be a voice for, hey, homeless youth need to be included in this, and they're not being funded right now, and they should be, and maybe we can do a youth priority to get it going. So that's kind of how that happened. And then the Metro Youth Systems Redesign is basically a committee that was formed to address, right now they're working on a coordinated entry process across the metro. And so just to kind of end this up, the outcomes I think are pretty good. So we went from literally $0 for youth homelessness to a total of 10.438. And we're looking at getting even more at the end of this legislative session. We're hoping to get at least $2 more million through our Homeless Youth Act, if not more than that. We're asking for 10, but we may be able to increase it from that 5.238 million to 7.238 million is looking like, hopefully. So Homeless Youth Act, it should be 11.38 million actually, because there's 5.238 and then Homeless Youth Act. 1.2 million, we kind of transitioned out of our Emergency Solutions Grant and Transitional Housing Emergency Shelter programs for youth. And then 3 million from the Family Homeless Prevention Assistance Program. And then we don't have the pilot anymore, but that was 1 million for support systems for homeless youth. And then 2 million out of our safe harbor is designated for specific shelter and housing programs for sexually exploited youth. So that doesn't go directly to homeless youth, but it's a similar population, so I just wanted to bring that up. And we increased the capacity, so went from 80 shelter beds to 123, increased our housing units, etc. And I'm not going to get into safe harbor because I'm really low on time, but if you're interested, I can definitely get you more information. But this basically set up our new response, so these youth are not getting ordered to juvenile detention anymore, but getting appropriately either reunified with family or placed in specialized shelter and housing programs that are not locked and have supportive services and things like that. I just want to really quick speak to this, which is that we do partner definitely with our county child welfare departments. And what we found is that it works really well because the child welfare departments have realized, wow, this housing shelter thing is not our expertise. What they've actually done is, in many cases, subcontracted with runaway and homeless youth providers to serve their youth that are aging out of foster care. So we have some programs that have specialized housing for youth aging out of foster care. And it's really found to be that the runaway and homeless youth providers know how to do housing. So they, in addition to all the Homeless Youth Act money, some of them are doing specialized housing for youth aging out of foster care and get contracted through money through the Fostering Connections Act or other methods with their county child welfare agencies. So what's next? Sorry, okay, I'm almost done. What's next is that we're asking for 10 million and the age increase to 24 for the Homeless Youth Act. We're asking for an additional $2 million for sheltered housing for safe harbor for sex trafficked youth and $2 million more for supportive services and street outreach. And we're also working on, as Jasmine said, I wanted to point out, we're actually one of the states that was awarded a grant through ACF to work on improving transitions for youth aging out of foster care. So our state child welfare department actually is running that and then is partnering and doing focus groups with the homeless youth community to help give homeless youth input into that process. And then we're working on coordinated entry. Sorry, it became ridiculous. It used to be called assessment. So thank you so much. I'd be happy to take questions at this point. That's a lot of information.
Thanks, Beth. And David Fink, our policy director, will be running around with a microphone, so if you raise your hand, he'll be happy to take your question.
Question?
Hi, Beth. My name is Lisa Tepper-Bates. I'm the Executive Director of the Connecticut Coalition to End Homelessness. And we've been helping with the rollout across the state of coordinated access systems, as we call it here. There's lots of different terms. One of the issues that we are trying to get a way to look at, and I know this is a national issue, is the intersection between youth-specific homeless services and what we tend to refer to as mainstream services that as a rule are adult-focused. And I wonder if you could share what you're learning in Minnesota about that intersection.
Well, we are still working on it. So that's kind of one of the bigger things we're actually working on is that, and we see this definitely the link partners not only with homeless youth providers, but adult family and adult providers, because you do definitely see some of those 18 to 24-year-olds ending up in homeless adults or homeless family shelters. Now in Minnesota, we consider it a best practice to serve youth who are experiencing homelessness within youth agencies, but we all acknowledge that it sometimes happens because the capacity of our youth system isn't as large as adult and families. Not that they have enough either. So what we're trying to do with our coordinated access assessment entry process is we're trying to kind of do two things. One is create a youth-specific tool that all youth agencies will be provided with across the 7-county metro area, which is tricky because we have multiple continuum of cares that we're trying to get their COC coordinators and all of that on board. And then the other thing is that we're trying to get a weighted score into our adult and family providers for youth. So we're looking at using a vulnerability assessment tool called the VI SPDAT. You may or may not know that tool, but we're looking at using that tool, and then we're trying to, if a youth is trying to access through the adult or family coordinated assessment process or coordinated access process, we're trying to get, the youth community is trying to get like a weight, like a vulnerability weight based on their age. And so we're definitely still in the process of working that out, but that's initially how we're looking at it. So, sorry, not a very great answer, but that's where we're at.
Well, thank you, that's helpful.
No problem.
Hi Beth, thanks for coming. I couldn't really tell you were from Minnesota when you first started talking, but I figured it out, thank you. My question is on count. For 40 years, since 1975 with the Runaway and Homeless Youth Act, people have been trying to come up with a count. And it's, as you know better than most of us, it's a very difficult thing. If someone were to ask you, what's your count in Minnesota? What have you come up with, and how we can articulate that here and other places around the country?
No, so that's a really great question. So we struggle in Minnesota a lot with our community time count as well. It's conducted in January, so it's usually like 40 below wind chill, and it's really tough to, most homeless youth are sneaking into buildings at that time, sleeping in hallways, basements, garages, so it's tough to find them in that time. So basically, we do utilize our point in time counts, but we consider it to be a gross underestimate. So the number we actually use in Minnesota, we have another research company called Wilder Research Center that's out of St. Paul that does every 3 years they do a survey of homelessness. And so theirs is done in October, and it's much more, much kind of larger scale than our point in time counts. And so from there, we find that a little over 4,000 unaccompanied homeless youth are homeless each night in Minnesota. And of those, it's like 2,600, I want to say, that are under 18, and then the rest are over 18, like 18 to 24. So those exact numbers are also in the current, like the 2015 report to the legislature on the Homeless Youth Act. And so you'll be able to get those, but at any rate, that's what the numbers are in Minnesota. So we tend to use those.
Beth, my name is Ann Farrell. I'm with the University of Connecticut, and I'm the director of the Center for Applied Research, and we've been working with this partnership over the last many months. And on behalf of all of us, I want to thank you for a very informative and frankly inspiring talk. When you hit those numbers, I think a lot of jobs in this room, so thank you. One of the things I'd like you to talk about for a couple minutes, if you could, is how you approach the concept of evaluation. I think that's really interesting and important, particularly in Connecticut right now. We're looking at a really tough couple of budget years, and there's an important and legitimate concern about accountability and performance measures. So can you talk a little bit about the process of evaluation, how you embedded that, and how that has evolved over time, and how effective you think it is? Any advice you have for us, we'd appreciate.
Yes, so we actually, evaluation is something we need to frankly work more on in our state. We don't have, it was basically an unfunded mandate to do, evaluation and reports to the legislature. So what the Department did, of Human Services did, the person that has my former position, who also came from the Homeless Youth Committee, what she basically does is she still collects outcomes through HMAS. And the main outcomes that we're looking for, and then monitors, so goes back to each agency once a year and looks through client, picks up random client files to make sure so we do a cross-check to make sure they're all accurate. Being stewards of taxpayer money, of course, you want to do that. But basically what she does is she looks for, the main outcomes we track are where youth go when they leave the program, where are they exiting to. The hope is that they would transition into stable housing, or in some programs transition back into family reunification when it's safe. She also looks for whether or not youth are increasing their income, whether or not positive youth development activities were provided, and whether or not youth are being connected with medical assistance and healthcare services. So those are some of the bigger ones that are actually looked for by the state, and I'm sure that there are more than that. I just can't think of them off the top of my head, but those are some of the big ones that we collect on and report back to our legislature. But we do want to do more on the evaluation front. because it would be great, for example, we talked a lot about, wouldn't it be great to have enough funding to actually do a large-scale evaluation every 2 years for the legislature and be able to subcontract with the University of Minnesota to do, have actual researchers that know evaluation much better than a state employee or myself when I was there. So, but right now that's the best that we can do on that.
Thank you, Beth. Great presentation. I work, my name is Frank Moons. I work with the juvenile justice youth, and I find that we have a really hard time, even when we find supports for youth around housing, in transitioning them out of that and into being self-sufficient. And I was wondering if within your program that you've developed and the legislation, if there's any component to help those youth become self-sufficient and transition out, if you do that as part of your program, or if you liaison with other community providers to provide life skills and job training, things like that.
That is a great question, and I appreciate it, especially since we have, one of our 3 focuses is on youth who are involved in the juvenile justice system, and the connection between that and youth homelessness is so real. So basically what we do within our housing programs is, and first of all, I will take a step back and say sometimes, especially in our scattered site units, it's tough to get those youth housed depending on their record or depending on when what age they did the crime. So we have a housing locator that works really hard with our scattered site programs on doing not only assessing youth for which housing program makes most sense, but youth that have barriers such as criminal histories. She has to do a lot of advocacy, and oftentimes has to go through many landlords before she finds someone to rent to that youth. So first of all, we do that. And then secondly, within the Homeless Youth Act programs as a whole, statewide, services for improving self-sufficiency or life skills, as we oftentimes refer them, are embedded into all of them. So we basically have within our drop-in centers, I'm sorry, except street outreach, but like within drop-in centers, emergency shelter, and especially within transitional living programs and our housing programs, we really try to get the youth into the housing program or shelter as quickly as possible, and then after they're there, provide either one-on-one or group, depending on the program, they do it individually or in group settings to provide basically help with life skills, and then each youth also individually works on it with their case manager, and they develop like a basically individualized goal plan, because even though I've been working with this population since the late 90s, I still sometimes am surprised. I'm like, oh, that's a new one for me. So each youth is different and comes up with different barriers, different things they need to work on. So in addition to having like a general life skills program, I think individual case management is what really helps with that too. So that's how we do it. And I would say within the Homeless Youth Act, that's how we really strive to have all of the programs operate. Great question though. Thank you.
So it sounds like the link has a variety, and its housing programs has a variety of different kinds of residential settings. So based on your experience, what have you found to be the most successful in getting youth to permanent stable housing? And if it depends on if the answer is something like some are better than others for different kinds of people, if you could elaborate on that as well.
Sure. Well, one of the things I love about our housing program is we do have different models because youth come in with completely different barriers. So we have, for example, one of our scattered site housing programs called Housing First. We're not that creative with names, I don't think. So we call it Housing First because it's designed for people who have, or young people that have significant mental health or physical disability barriers. And we want to get them into housing anyways and not make them go through all these other hoops first and then get them connected with those services. That works really well for both young people with disabilities, I would say. We also have rapid rehousing, which works better for youth that basically don't have as significant of barriers. It operates, I'll just be very honest and say it operates exactly the same as youth transitional living programs do, or transitional housing. And so basically, and it was it used to be TLP and is now rapid rehousing, but it's the same exact model. And basically those, what the youth tend to earn, what we try to do is have them out-earn themselves out of the program, so that they can take over the lease on their own. So those youth do really well in that program. Some single parents also do. We have a rapid rehousing program for young families, like 26 units. That works really well for them as well, because we're able to sometimes get larger units if we need to, et cetera. But I think that I cannot stress enough that it's also good to have a combination of scattered site as well as site-based housing for youth, because we do have a significant number of youth that have very unhealthy relationships, domestic violence situations. And so for those particular youth, it's great to have them within a site-based program with monitored staffing 24/7, because then we can, basically prohibit those abusers from coming into the building. And so we found that that works really well for those youth, as well as youth that, frankly, almost, a lot of youth will say, and I remember this back in my student days, Beth, I just want my own apartment. I just want my own apartment. Hook me up. And I'm like, well, okay, let's talk about what that means and see if it's, see if you still want it. But what happens is sometimes we've actually put them in their own apartments because that's what they said that they want and what we felt like, the dad says it's a good tool. And then they end up really doing better in congregate site or site-based because they get lonely at 3 in the morning. They get scared, lonely, and they want to talk to somebody. And so having that model of, and I know it's more expensive, so sometimes people get nervous, but I think having scattered site and site-based, whether it's rapid rehousing, permanent supportive, or whatever you want to call it, I think having those two models for youth is really critical because some youth do much better in one setting versus another. So I don't, both is what I would say.
I'll just clarify, when you said that rapid rehousing is really a traditional model, it's traditionally in place, though,
Yes.
right? It's not separate, so,
Yes.
okay, yeah.
Yes. The youth take over their own lease payments at the end of the program.
I have a couple of questions. How long do you provide the housing for?
So what's really nice is in the Homeless Youth Act, we specifically didn't put a time limit. However, a lot of our transitional living providers couple the funding with transitional housing funds, either through HUD or rapid housing funds. And so usually transitional living programs are either 18 months, if they're funded by WISB, or 24 months, depending on their funding sources. And what we're finding even at the link is that an average length of stay for youth in a housing program is typically 16 to 18 months anyway, which is a great amount of time. You can get a lot done, but that's kind of what we're finding. And then the other programs at the link, in our Homeless Youth Act, well, the Homeless Youth Act, does not have any length of time. But what I would say mainly in Minnesota is transitional living programs, transitional housing, rapid rehousing, all have a 28 or 24-month limit, and then supportive youth housing has no limit. But we're finding in all models that there is a common 16 to 18 months average length of stay, regardless of model. So.
And then the question is, why don't you just do a count in a better time of year so you can find those people who might be found a hallway to sleep in or a basement somewhere?
I'm sorry,
Count them better by counting them in June or something. Why wouldn't you just change the date?
because it's mandated by HUD. And we tried. See, we tried. We tried to say, don't you know Minnesota is one of the coldest states in the country? It's really hard finding volunteers to do the last week of January, let alone finding the youth, because youth are incredibly resilient. I even worked with a youth who snuck into a dog kennel once to stay warm. Like a boarding kennel for dogs, was sleeping with dogs. Like, it's just incredible how resilient and creative they are to finding warm places to sleep in Minnesota. But that makes it really hard for PIT count volunteers to find that last week of January. So we do have that, thankfully, every 3-year count by Wilder, and that's the one most Minnesotans tend to use. But it's a great point, and I wish we could change it. If you have any connections to the feds, please ask them.
One last question. If you have individuals that have substance abuse problems, can you connect them to services that can help them with that?
Yes, we definitely do that. So we serve a significant number of youth that have substance abuse issues and don't prevent them from moving into housing at the link because we feel like that's not fair or right to do. And so youth that come in that do have substance abuse issues, we would connect them definitely with supportive services. We don't have chemical dependency treatment per se on site at the link, but what we do is we work with our partners within Hennepin County, Dakota County, the other counties to basically get them connected with that. Is it always successful? I'm not going to lie to you and say it is. Sometimes we see those youth really struggle and come back through treatment many times, but the good thing is we're able to provide housing consistently through all of that. despite their substance abuse issues.
Well, I think I speak for all of us here when I say thank you. This has been a great discussion. I'm sorry. So thank you again, Beth, and thank you all for your really insightful questions. Next, we're going to talk about how Connecticut has been addressing some of the data challenges around youth experiencing homelessness. And we have a fantastic 3 speakers. So we have Brian Roccafiore, who is the Director of Homeless Management Information Systems and Strategic Analysis at the Connecticut Coalition to End Homelessness. We have Louis Talarita, who is an education consultant with the Connecticut State Department of Education. And we also have Raven Sadler, a student from Kennedy High School, who was a partner in the youth count process in Waterbury. And I just ask that you hold all of your questions until all speakers speak.
Thank you. As Elizabeth said, my name is Brian Roccafiore. I am the Director of the Homeless Management Information System and Strategic Analysis for the Connecticut Coalition to End Homelessness. My running joke is that I'm the data guy that doesn't like public speaking, so with my name and job title, I'm already halfway through my presentation. Thank you for bearing with me. So for the next 25 minutes, here's what we're going to do. I'm going to give a brief background as to how we got to where we are with the youth count. And then we're going to have Raven Sadler come up and talk about how she was involved in the planning of the count as well as addressing homelessness issues in the city of Waterbury. Lewis is going to come up from the State Department of Education and talk about the broader strategy of how communities and schools are connected. And then I'm going to come back up and show you some of the preliminary findings that we got from the youth count. So that being said, Alicia started off her opening remarks talking about the Invisible No More report. And that was back in 2013. And what that was a qualitative study about youth who are experiencing homelessness in Connecticut. They identified, I believe it was 98 youth who were housing unstable or homeless in the state. And one of the main recommendations from that study was to go and conduct a quantitative study of the number of youth experiencing homelessness in Connecticut. So working with the current data that we have on youth homelessness, it's been touched on a couple of times already about the pig count and how unreliable at best it is for youth homelessness. My example of that is in the 2014 point in time count, it identified 5 individuals under the age of 18 who are currently experiencing homelessness. 5, on one hand, 5. So if you talk to any of the youth providers in the state, they're going to tell you that that is just woefully inaccurate because they probably see something that in the course of a day in their work. So understanding that the point in time count is really good at getting at what it gets at, which is adults who are accessing services in our system and the adults who are living unsheltered because they are very, very different populations. We worked with a different methodology for our youth count. So we started as a subgroup of the homeless youth work group of Opening Doors. We met with a bunch of local providers, state agencies, and most importantly, youth to help design and implement our count. And we started in the USICH report, youth count, exclamation point, for our jumping off point of our methodology. What that was a study of 9 different areas around the country, Hennepin County being one of them, who have had enhanced youth counts in their areas, and what the lessons learned were from each of those studies. So, using the ICH report and understanding that it is an imperfect science for counting youth homelessness, what it really doesn't get at is the individuals who are housing insecure, who are doubled and tripled up, who are staying with a relative, who couch surfing, or whatever the case might be, who aren't accessing the mainstream services, whether they don't trust those mainstream services or whether they're not eligible for mainstream services, they just aren't. So our point in time count in Connecticut was originally planned on January 28th, and the youth count was going to take place from January 19th to January 30th. Who remembers what happened in the last week of January? It didn't get Minnesota cold, but it got pretty cold, and we got hit with what the National Weather Service called a potentially catastrophic blizzard, which we can all see the parking effects of still out in the market. So we had to extend the youth count to go from January 18th to February 18th, which is when we pushed the point in time count to. So that's why we don't have more definitive numbers today, because we've only had about a month's time to start entering and analyzing our data. So I'm going to say this a number of times today, that the data we're going to look at later is preliminary. So And that is one of the many, many reasons why. So in that expanded time frame, what did we do? That's a good question. So we had local leaders in 7 areas around the state. Those 7 areas being alphabetically Bridgeport, Hartford, Meriden, New Haven, Norwalk, Torrington, and Waterbury. And what we did in those areas is that we had local leaders who built up their local teams, engaged the existing infrastructure, engaged the schools in those communities to perform a more enhanced outreach. So there was more feet on the ground, more outreach happening. And each local area was able to design their outreach to meet the local needs of their area, because every area doesn't have the same resources. Torrington doesn't have what Bridgeport has, doesn't have what New Haven has. The other areas of the state that weren't in those 7 cities, they were all covered by our traditional point-in-time count methods, with additional questions asked of anybody who was under the age of 25. So the survey that we used for our youth count was designed by our group with input from youth. Thank you to the Institute of Community Research, who did some battle testing for us on youth who had some focus groups so that we could better refine the questions so we can get more accurate data. And I spoke before about the planning process and how youth were involved in that. In the early stages, we were talking about outreach strategies, specifically around social media outreach strategies. And it became pretty evident pretty quickly that nobody around the table knew exactly what we were doing in outreaching to runaway homeless youth, specifically around social media. I think I have like 12 people following me on Twitter. So I'm not the guy to ask about social media outreach strategies. So we did engage in youth on a local level. And there was also the school estimation piece, which I'll talk more about in a little bit. But to the youth involvement, I wanted to bring up Raven Sadler, who's a student at Kennedy High School in Waterbury, who's going to talk about her involvement in this survey and other work in the city of Waterbury.
Good morning. I am a member of the WIA, which stands for Workforce Investment Act, program at Waterbury Youth Service. Participating in a year-long project on homelessness, my group gave input into the survey questions and also suggested places where homeless youth might be found. I worked with a group of students that distribute surveys to youth in downtown Woodbury in the Brass Mill Center Mall. My experience shows me that people are abandoned sometimes due to their sexual preferences and kicked out of their homes and unable to afford a job due to recent government controls. Have a lack of resources and or disabilities that prevent them from working. I felt good going up to people and trying to make a difference in their life, showing people that are homeless, that there are some people in the world that still care. It made me feel like I was accomplishing something step by step. My recommendation is that the survey should include a question regarding the opinion about what would make a difference to them. When some people think about homelessness, they think about people that didn't do anything with their lives and who end up where they are because of the choices they made. However, that isn't necessarily the truth. From my experience in the stories that I heard from people, there are many circumstances that led to homelessness. I spent time at St. Vincent de Paul's Soup Kitchen, where I interviewed several of the people who visit the shelter for support. They explained each of their stories to me. Also, when speaking to the staff, they really made me realize the hardship people face when looking for food and shelter. They also made me realize that the shelter are not always guaranteed due to the space limits. However, the staff showed me that they do as much as they can to help. Also, I went to the Salvation Army where I helped clean and reorganize the basement. I observed where and how people live. The spaces was really small. It really made me think about appreciating what I had because many people will like the life that I'm living. I believe that this is a big problem that has to be changed. Nobody wants to feel worthless or unloved. We need to get together and make a change to get as many people off the street as possible. Nobody wants to be homeless, and they shouldn't be. I learned that homeless can happen to anyone. It's not a condition, it's a situation. Thank you.
Before we have the State Department of Education come up, I wanted to thank Raven and all of the youth who were around that helped us out in this effort, because we would not have been able to pull it off without your assistance. Thank you so much. One more time for Raven. So now we're going to bring up Louis Talarita from the State Department of Education. going to talk about the broader strategy between community and schools. There you go.
All right, good morning, everyone. So, I just wanted to start talking about this issue in terms of identification. So, from the school's perspective, under the federal law, the McKinney-Vento Act, school districts have the responsibility for identifying homeless children and youth in their school districts. And obviously, the issue isn't about, the purpose isn't to see how many kids we can count, but it's about connecting them to the supports and services that they're eligible for and that they need in order to gain student success, academic success in their time in school. So this is, again, a critical step in this work is identification, getting youth in school and keeping them in school. That's the key provision of the McKinney-Vento Act, and that's what supports this work. So that's not to say that we certainly don't have some challenges in this work in terms of identification at the school level and in the community, as you all probably know. Youth experiencing homelessness are difficult to identify, and there certainly are challenges. These barriers can be social, institutional, and data related. From the social perspective, there's the stigma that's attached with being identified or categorized as homeless. Certainly youth who are on their own may be fearful of the criminal justice system, a child welfare system that they're not familiar with, but also fearful of the fact that they may be, in terms of identification, they may be sent back to a home life that they've already determined is not conducive to their health or their wellness. And then from the institutional standpoint, we've created certain barriers within our own systems. Most notably from my perspective is the issue of residency in our school districts. We deal with this issue all the time. It's a built-in process in which where you go to school is dictated by where you live. Okay, if you don't have a form of residency in a town or city, you can't come to school here. That poses a barrier. The McKinney-Vento law is certainly there to assist and to, it's the only law that I know that actually circumvents residency. But still, there's barriers to ensuring that this actually takes place. And then certainly we have data barriers as well, in terms of how we connect data together, how we share data with each other. These are all challenges as well that don't get us to the point where we even really clearly understand how well we're doing in terms of identification of children and youth. And again, the sole purpose is that we're just trying to ensure that these children, these youth, particularly as we're talking about here today, are connected to the services that they need. But certainly there's solutions, these challenges create opportunities and these opportunities for success in this area and to identify more students and create those supportive environments that they need. And so there's certainly strategies that we can consider. Raising awareness is one, an important, a key one. Reaching out and highlighting this issue, just like we're doing here today, but also back at your own local community levels. Right, within the schools, it's as basic as posting awareness rights and things like that. Posters in schools that children and youth can come in contact with, find out more, give them lead information on who to contact as well, to find out more and how to assist them in terms of their challenges, their struggles. Training administrators at the school level, all school personnel, so that they identify with the McKinney-Vento Act more clearly, understand their purpose, their role in that. So these are all some basic level raising awareness approaches that can certainly assist in this area of identification. Developing partnerships, collaboration is key in terms of identifying homeless youth. So some of the traditional suspects like youth service bureaus, school districts, local police departments, but also some of the more non-traditional from the perspective of schools, that schools connect with their continuums of care, housing agencies in their community, people that they're not necessarily or likely to have perhaps collaborated with in the past, but certainly key to sort of move forward with to improve these areas of identification. And then also other federal programs that have similar mandates to identify children and youth in homeless systems, in homeless situation.
like Head Start, IDEA, or special education programs, Birth to Three, for example, other housing programs funded through the Housing and Urban Development, runaway and homeless youth programs. So these are other federal programs that have similar mandates to identify and serve homeless children. So connecting with them from the school level is certainly an important one. Reaching out to youth, that's certainly a key element to consider here, that creating an environment or a system in which youth feel comfortable coming forward and describing their circumstances so that they can get the supports and services that they need, but also an environment in which classmates, schoolmates, friends who know of particular circumstances involving the other folks, other children or youth that are experiencing homelessness, will connect with an adult, like a school counselor, or the homeless liaison in their district, to describe that they understand that another student, a friend of theirs, has a situation, and how can we get them the supports that they need. And also the use of social media to create a space where youth voice is heard. I'm not going to pretend like Brian to be able to express what the specifics may mean in terms of social media. As a 47-year-old man, I'm sure I'm not the expert in that content area, but there are ways, and schools certainly can enlist in ways to explore this issue in social media and connecting with youth at their level. And then developing the data, reviewing the existing local data and asking, if we're identifying youth experiencing homelessness, current data, past year data. So it's a matter of even collecting a lot of different sources of data together so that communities can understand and school districts can understand how well we're doing at this in terms of that identification. And also developing agreements with other programs that we could share that data is an important element as well, because we certainly have privacy issues and such that have to be taken into consideration. That certainly is another point to bring up, is that even in terms of that identification topic, brings up sort of a harshness to it. And again, we want to certainly understand that any efforts that we're taking to identify these youth on their own need to be grounded in sensitivity and respect, and understanding that it's in what's in their best interest that we're trying to bring together. So from that perspective, as we look about this school involvement, this cycle that I've discussed here today, I think that I know that the expansion of the point in time count to include youth connecting with the schools in those communities sort of touches on all of this, raising awareness, developing partnerships, reaching youth, and developing the data to a better place. Also in terms of the use of the estimation survey that I think someone's going to talk more about. The estimation survey in which schools are actually utilizing other students as a whole, the population of their high schools, to identify whether or not they know of other students that are in these circumstances. Again, still connecting on all of these levels. So with that, I will pass it back.
As I said before, and I will say again, these are preliminary data points that we're putting out. This is my humble request to have this information not show up in any legislative asks or grant proposals. The full report will be out soon, then you can go ahead and quote me any which way you want, but until that happens, please don't use money. So through the youth count surveys, we were able to collect about 1,300 or so surveys from youth. And by surveys, I'm not talking about the school estimation side of surveys. This is the street outreach, we'll call it for today. So there were 1,300 surveys administered. 43% of them came back as students who were, or not students, youth, excuse me, who were in an unstable living situation. For the purposes of the numbers from here on out, I'm only going to be talking about those youth who are in an unstable living situation. 48% female, 50% male, 2% other. For data visualization purposes, it was hard to lump in the 4 other categories that we had there, but the other consists of the transgender, male to female, female to male, other, and one other category that escapes me right now. Yasmin talked before about the LGBTQ community and their overrepresentation in our population. And our numbers bear that out too. If you look at the total sum of the surveys we collected of all youth it was around 15% identifying as LGBTQ. If you get down to the unstably housed, it goes up to about 20%. And then if you take those who are living in the unsheltered, sheltered situations, it jumps to about 30%. So that is a major contributing factor here in Connecticut, which bears out the national numbers as well. Other interesting things that I pulled up in the last 2 days, because that's when we finished entering our data, was of those who answered the question on the race, over 20% refused to answer the question in general. Not that they didn't answer the question, is that they refused to answer the question. Of those who did, 32% were African American, 20% identified as multiple races, 23% were white. And we spoke about this earlier too, about pregnant and parenting youth being overrepresented in the population. And of the unstably housed youth, 20% identified as pregnant or parenting, with the overwhelming majority of those pregnant and parenting youth being females in our system. And from the service connection side of things, about a third of them were involved in DCF or foster care. 24% are involved in the criminal justice system at some point. And of those who moved multiple times, 38% had moved more than twice in the last 6 months. If you take in they moved once in the last 6 months, that number jumps dramatically. So being cognizant of my time, we're going to also talk about the school estimation survey, which was a project that took place in the 7 cities up there. You might notice that they're slightly different from the 7 focus areas, partially because of that ice age that hit Connecticut and snow, school cancellations, and the availability of the administration to actually make it happen. So it took place in those 7 cities, which happened either in a homeroom or at one period. So all the students in the schools got the survey at the same time throughout the day that asked them to identify individuals that they knew who were either homeless or housing insecure. And it asked those 7 simple questions up there so we should be able to de-identify and get a pretty solid count of how many youth the kids, or the kids, sorry, I just call them kids because I'm getting old. How many individuals in that school would be able to be identified as homeless or housing insecure. And overall, we got over 10,000 different surveys collected in the state. One example of I obviously haven't had time to go through 10,000 surveys in the past month, but one of them was Harvard Public High School's Law and Government Academy, where there were 161 surveys completed. 37 different students identified at least knowing one individual who was unstably housed up to the age of 19, and that totals 40 different unstably housed youths that were identified in this one school with 161 surveys. Only 15% of those identified were living in shelter or some other social service housing. Why I highlighted that one is that speaks to the numbers that we're actively able to capture in our data collection systems. Because those who are doubled and tripled up with their relatives and friends or staying with a boyfriend or girlfriend, they might not be connected and we'd have no accurate means of counting them outside of what we just did with our street outreach project. Length of time homeless for the individuals who were identified in school, most were homeless or housing unstable for 2 to 5 months. A small portion over 2 years, nobody in the 1 to 2 year time range. So what we're planning to do next is take a step back and fully analyze all the data. Again, preliminary, if I haven't said enough already. The full report is going to be out in May in conjunction with the full point in time count report. Why all the way in May, you ask? That's a good question. Because the point in time count deadline to get the information into HUD is in the middle of May, which is when the final numbers from our communities will be in, and anything before that would be premature at best. So we are just being responsible in making sure that all of our data is as accurate as we can, so I don't have to put out a report and then issue a release saying that the information is wrong, because that's the last thing I want to do. We are going to be meeting with all of our local leaders next week to debrief on what worked in Connecticut and hopefully refine our methods so we can come at it better and stronger for if and when we decide to do this again. And then to use the data to help the implementation of the Opening Doors for Youth Action Plan, which is what Elizabeth and Stacey are going to be talking about in their next presentation. So, thank you. And with that, I will ask Lewis, wherever you ran out to, there you are, and Raven to come back up if there are any questions, if there's time. Elizabeth.
You have 3 minutes.
I have 3 minutes. I was asked to leave 10 questions next week, so sorry.
To be clear,
get back to that big stop sign, and I thought that was as clear as I could be.
Yeah, hi, my name is Alan Coker. I'm the board of directors for In the Community, and I'm also a health consultant, mental health consultant. I like what you're saying. I used to be homeless, so what you're saying I really respect, and I respect everyone in this room for coming. My question is, I heard mention about how to break down, give more information to these different resources like the police. I know when I was homeless that there's a big drift. So besides giving information, I was wondering what is it more of spending more time with them to get an understanding? Because homeless people and youth, they're considered the enemy, to be realistic. And I know from, they are a good resource. The police are probably the ones that see the youth most, but the youth are going to run away from them. And so I was wondering what is devised to contact the youth. I know you have the young woman there from Waterbury. Are we using youth to reach out to youth? Because I know if it's the police, it's not going to really work out that well.
Yes, we was using youth to go out and distribute because I don't feel like an adult go to the youth and youth to really talk to you as comfortable as they'll talk to somebody my age. So we use people my age to go out and try to reach out to them.
If Raven and I approach the same person, we're going to get very different results. We might have the best intentions in the world, but
I think I brought up the issue of police, and I wasn't referring to it as schools giving information to police, but rather police, departments, police officers who are out on the streets and come in contact with youth that they identify maybe on their own. It's not a matter of bringing them into custody or anything along that lines, but connecting with schools to help that identification process, to support that, academic success, keeping them in schools, getting them in school, getting the supports that they need. So I think that thinking about police departments and officers are an element of, who schools and communities certainly need to look to sort of help in that identification process, not for the purpose of, bringing them into custody or creating more barriers to them, but to assisting them. So kind of, maybe taking it to a different level, perhaps where they currently are.
Thank you.
Just two clarifying questions. So the 2 to 5 month average for the Lincoln homeless episode, was that from the school estimation data?
that was from the school estimation data at that one specific school.
Okay. And then my second question, getting at the involvement with UCF and juvenile justice, what was the language of the question? What is involved in?
I don't have the survey memorized, but what I will do is I will get that to Elizabeth, who will put it up with the document. I'm making work for Elizabeth right now. But I'll get it to her, who will upload it with all the other documents along with the slideshow.
Thank you all for talking about the youth count. I know we're all anxiously awaiting the final results in May. Just to note that when this presentation is loaded onto the partnership's website, it will be watermarked preliminary, just as a reminder for you all, and not include any of this data in any reports. Just want to re-emphasize so Brian doesn't come after us later. So next up, I want to introduce Stacy Violante Cote, who will be talking about the Opening Doors for Youth plan. I'll be jumping in as well. For those of you who don't know me, I'm a policy analyst with the Partnership for Strong Communities. Stacy will be kicking us off. Stacy is the director of the Teen Legal Advocacy Project at the Center for Children's Advocacy, and she also chairs the Reaching Homelessness Youth Work Group, which is a statewide group convened here through the Opening Doors Connecticut Fund. So welcome.
Thank you, Elizabeth, and I just can't tell you how thrilled I am to have everybody here. I know a lot of you are friends who we've sat around tables together and done a lot of work together over the past several years, and a lot of you I know I've either spoken to by phone or email, and who have had more recent interest in talking about homeless youth. So I thank you all for being here. This is our last presentation of the morning, so just bear with us for a short time longer. I'm going to talk to you about this handout that you should have gotten when you came in. This is an abridged version of a much longer plan that we're calling Opening Doors for Youth, an action plan to provide all Connecticut youth and young adults with safe, stable homes and opportunities. It only took about 30 or 40 people to come up with that exact wording over several hours. So we hope you enjoy this handout as a brief overview. But as we've said throughout the morning, we'll have the full plan and the details in the full plan available for you on the partnership's website immediately following the forum, and you can dig into it a lot more. So Elizabeth and I are just going to take you on a short journey now of where we want to go, how we got to this point, and what are the steps we're going to take to get to where we want to be. Starting here with our goal, our vision of what we see ahead. And what we see ahead is a future where all young people in Connecticut have safe, stable places to live and opportunities to reach their full potential. It's broad for a reason. As you heard from our speakers from USICH and from Minnesota, it takes a lot of pieces to put together to realize that vision. And so those of us who've been working around the table together really felt like this captured where we want to go. Elizabeth is going to jump up here for a minute and talk a little bit about how we got here.
Thanks, Stacy. So you all might be asking yourselves, how was this plan developed? And as Stacy just said, there have been quite a number of partners involved in this process. It's actually the culmination of a year-long process that the Reaching Homes Homeless Youth Work Group of Opening Doors Connecticut overtook. And as I mentioned earlier, this is a partnership of state agencies, local providers, advocates, and funders. So it's really exciting that we're able to show it to you in the presentation today, as well as see the final print version online too. The larger Opening Doors Homeless Youth Work Group it meets regularly about monthly, but it's split into 3 targeted subgroups to have more focused discussions on how to develop the plan. And those centered on housing, services and supports, and data collection. And you've heard throughout the presentations all today on why each of those areas are really critical. And I'll touch on some of the key findings. So the housing subgroup found that youth and young adult homelessness exists on a continuum, ranging from intermittent housing instability to absolute homelessness. We know that youth and young adults who experience homelessness range in age from 14 to 24. We also know that they don't necessarily mirror the adult population, so more often than not, they're staying with friends, relatives, moving from couch to couch. Maybe they're staying in their car or a friend's car, and sometimes they're staying in stairwells and places like that. We don't always see them out on the streets like we might more commonly with the adults. We also know that some of these folks are on their own because their families lost their housing, and for whatever reason, they're not able to stay with them for the time being. Because of this, and because of this continuum, we know that we need to have a range of different housing options for these youth. And so the plan you'll see will outline quite a few different housing options and different services that we need to offer. Stacy will talk more about these in a bit. The second thing that we found through the services and support subgroup was that youth and young adults who have either left, are forced out, or have never been involved with a state-sponsored system experience really high barriers to accessing services that they need to stay safe. So right now we know that fewer than 7 private agencies around the entire state of Connecticut offer the really necessary street outreach, respite, and crisis response options that these youth need. And we know that these few services are also limited geographically around the state. The group found that some services like mentors and access to funding for higher education are also limited for youth who have not been involved in the state system, so we need to expand access to those types of resources. And there's also interest in learning from current research about how to expand services to reduce homelessness for youth who unsuccessfully leave state systems, because we know that these youth do have higher rates of experiencing homelessness, so we need to be more proactive in looking at the area from a prevention standpoint. And our data team, data subgroup, as Brian talked about earlier, has really been thinking about how to collect better data so that we can talk about the numbers of youth experiencing homelessness in the state of Connecticut, and we can use that to advocate for resources that match the need. So as Brian talked about, we did hold the first statewide youth count this year in January in Connecticut. Again, more on that in May. And then we also use some guiding principles to shape our work and develop the action steps that Stacey will talk about that are outlined in the plan. The first is that, as Jasmine has talked about, Brian's talked about, Beth talked about, if we're going to be expanding a service system for youth and young adults experiencing homelessness, we need to have the youth voice at the table. We were very fortunate throughout youth count to have youth at the table, and we were very fortunate to have youth consultants work with us in the development of the plan. And they helped provide information about where and how they're accessing services, what some of their frustrations are, and what they really need to become more successful in life. And we are advocating that that be continued throughout the planning and implementation process for this plan. The second thing, as Jasmine talked about, is that we really need to align with the National Opening Doors framework to prevent youth homelessness, which focuses a lot on advancing data and service systems to develop these tailored and effective interventions for youth and young adults. So you'll see that we reference that in our plan as well. It's a fantastic resource. Thank you for developing that. And lastly, we know that we need to model our plan and our interventions off of best practices for youth and young adults experiencing homelessness. Now, a lot of the federal and state plans just recently adopted youth homelessness in their plans, so we know that some of the best practices haven't been around for very long, but we do know that some, such as trauma-informed care and positive youth development, do work, and so we do need to incorporate them in our plan. But we also need to stay open, and as these emerging practices develop, we need to think about how we can adopt our plan to be more effective and more evidence-based. So that's kind of where we are. Now Stacey is going to walk you through some of the key strategies that we developed in the plan and what action steps are under each of those.
Okay, so the youth work group and the subgroups and all the folks who came to the table have really identified 5 strategies going forward, addressing different areas of need. But before we get there, we did have 2 what we're calling overarching strategies that we think are really important. That's because these 2 speak to the specific needs for both collaboration and coordination. I think as you heard Jasmine speak earlier, and you heard Beth speak, and then you hear about our count, we're talking about the areas of education. We're talking about the areas of child welfare, juvenile justice. We're talking about mental health, and we're talking about housing. This cuts across so many different, not only agencies, but areas of expertise. So that in thinking about how could we realistically get this plan done, we know that we need to have in place some ways to collaborate and coordinate across these. So the plan calls for 2 pieces to do that. One is a youth and young adult housing services coordinator that would work statewide. And the second is a funding and transparency mechanism so that all services targeting youth and young adults with housing instability in the state would have a way of being prioritized, of looking at where pilot projects might need to be implemented, and setting standards for accepting funding from these funding sources. So these 2 we call our overarching strategies, which we think are critical to implementing the rest of the strategies that we've outlined. So our first strategy is around creating better tools to identify, screen, and refer youth in need. Going back, as you heard mentioned earlier, of the Invisible No More study that was done in 2013, at the behest of the youth work group with Yale, we know that most folks were saying to us, we have just not asked youth about their housing stability. We work with youth in all different kinds of ways, but we've not asked that question. And so that finding helped us to think through in our subgroups, how are we going to address that? And so some of the strategies under this, some of the action steps under this strategy include screening tools for housing instability across systems so that we can be asking the same kinds of questions. I think you heard Beth mention the work that they do in Minnesota with regard to having the same screening tool for each of the folks touching the population. As well, developing more of the street outreach drop-in centers so that we have more access to youth and we have a better way of knowing who they are and having a point of contact with these young people. As mentioned earlier, Connecticut is very geographically limited in these services, and the funding right now really only comes from the Federal Runaway and Homeless Youth Act and some limited state funding that we were able to secure. So this means that the funding is quite competitive, and we win or lose it in Connecticut depending on the year. So we have not found a way to really boost and expand the services that we have, which we'll actually talk about a little bit more in a moment. This also speaks to the action step of creating an information and referral system for young people. Coordinated access is and figuring out how youth will fit into coordinated access. We had wonderful youth consultants at the table with us telling us what they would do and what they wouldn't do to access information. And those of you who are shaking your head up and down know that youth access information in different ways than adults do. And so we really need to take that knowledge and create an information and referral system and so that youth are accessing services in a way that's friendly to them. We need to consider a triage tool of how we'll define who's the most in need. One of the promising practices that our partners, the Corporation for Supportive Housing, have brought to the table is the TAY triage tool. I know in Minnesota they use a modified version of a vulnerability assessment that those of you who are homeless providers know as the VI-SPDAT. And what we really need to do is say which population is going to require the most services and the most support and pull that out and know that we need to do that from the beginning. And then we need to really look at school-based approaches. We have our partners here in education, and we know that that is a major place to reach youth. And so what are ways that we can in the schools do awareness campaigns and outreach campaigns and the sort of first aid model in schools. It not only helps with kids accessing services, but the issue that Louis talked about earlier around how do schools identify this population for services, that comes from the awareness piece and the normalizing of knowing that this exists amongst peers. I spoke a little bit about the need for expanding direct services and support across the housing continuum. I think that was very clear from our previous speakers as well, that you really need to have the full continuum. From the front end of where am I going to sleep tonight so I'm safe, to the other end of the folks who are going to need a more permanent option, and all of the services in between. And right now in Connecticut, it's very spotty. And I spoke about the geographic limitations. There's also program limitations. We have very few of the transitional living type programs. Our short-term respite beds and crisis services are limited. There's other national programs such as Safe Place, which is a program that some parts of our state have and some don't, where young kids can, or folks, any kinds of youth can self-refer based on a sort of sign that providers in the community have on their doors, and they can self-refer saying, I need help, and then there's a protocol for those youth getting access to help. We also need to think about what happens with our services and supports for youth once they leave state systems. Do we know how they're doing? Do we know what successes they're having? Do we know what failures they're having? Do we have either state or nonprofit support to be able to check up and find out how they're doing and provide supports before they get to an absolute homelessness scenario? We also talk about the need for what we're calling low barrier housing assistance. There are models in other states around specific populations. So for instance, in some states where schools and housing providers have come together to have housing just for kids who need to finish high school in their community. And it's partnerships between school districts and housing providers to make that happen. And those are some of the more lower barrier access to housing supports for some kids who may not need the longer term support, but who might need it for a specific time period or for specific living skills and such. We also have to look at providing and improving training and technical assistance for providers. I know some of our partners in the state have begun to do this. Connecticut Coalition to End Homelessness does training around access, information about youth and positive youth development, and Corporation for Supportive Housing, I know, has done some learning and sharing amongst providers. But what I know is that every time I go out and talk, we get a lot of the adult providers who are saying to us, we have a lot of youth in our programs and we just don't know how to serve them or what to do. And so the training and technical assistance really needs to be evidence-based on what we know about positive youth development, as Beth spoke about earlier, trauma-informed, and what does it look like to be working with an 18-year-old mom, a 19-year-old mom, in a family setting versus working with an older parent in a family setting. Again, we think it's really important that we have youth involvement in the training and technical assistance. Youth are the ones who can tell us what their experiences are, what has worked for them, and what hasn't. Of course, we also have to consider specific subpopulations. And we know from Brian's data, from the national data, we have to be thinking about gay, lesbian, bisexual, transgender youth and their experiences in accessing services, and then the pregnant and parenting youth population, and then also the youth who are victims of trafficking. And there's the trainings around the best knowledge that we have across the country on these. We've spoken a little bit today about improving our data collection. We spoke specifically about how we've embarked on the homeless youth count in Connecticut, how other states have done that. We need to also be looking at the newly integrated HMIS and RIMUS reporting systems and having that be a universal access point of data. And looking also at practices regarding sharing information across systems and protocols for sharing information across systems. We'd love to get to a point where we know somebody's housing stability status at point of entry with our state systems and at point of exit with our state systems. Lastly, there's a group of strategies that really look at existing policies or new policies that we might need to address. And so we're looking at policies around child welfare and youth who might be leaving child welfare unsuccessfully, and what are some of the policies and practices that might contribute to that. Looking at youth who are adolescent boys who are being excluded from some of the family shelters right now, and looking at how that could be addressed both structurally and otherwise. And then in general, looking at youth who are wanting to access services, who may be on their own, services such as GEDs, access to mental health, access to physical health care. But without a parent or without certain documentation, their access is limited. And how can we address those scenarios so that we can have youth better access to support services? So at this time, I'd like to thank everybody who contributed both to the work leading up to the plan, the writing of the plan, and the folks who convened everybody around the table to do the plan. Everybody from the staff here at the partnership and at the Connecticut Coalition to End Homelessness, our partners at the Corporation for Supportive Housing, some of our generous funders from the Melville Charitable Trust and the Tao Foundation, and our friends from UConn Center for Applied Research and Human Development, and Youth Catalytics, who really all helped us to work over the past year to get our thoughts and concerns into an action plan. As I mentioned earlier, the full action plan and a full description of the strategies are available on the partnership's website, and you have that on your agenda, and as well the PowerPoint will be available on the website. I think we have time for a few questions before we'll have to close out.
Hi, I just have one question. When you mentioned the low barrier housing model between schools and a housing provider, is there any example in Connecticut at this time?
No, not that I know of.
Okay, you know of any model outside that I could look at maybe?
We do. We have some of our partners at some of the national organizations have given us examples from other locations which we can share with you.
Okay, thank you.
Hi, my name is Griselle. I currently work for West Hartford Public Schools. My question is, have you set a time frame in how to get this strategy going? I mean, the reality is this has been happening for a very long time. We know that the biggest problem is funding. And now we're facing budget cuts and so forth. You know, do we have a time frame so that we can get the ball rolling, so to speak?
That's a great question. So, and you remind me to talk here for a second about the fact that while youth homelessness has been going on for a long time, and those in the room, I look at some of our providers who've been doing the work, as John said, for 30 years or so, and one of the things we know is that the federal plan to end homelessness was only amended in 2012 to really begin to direct concerted strategies toward this plan. And then in Connecticut, we've set our goal of ending youth homelessness for 2022. So over the last year, we've taken time to really plan out how we're going to do that. And really now our work is to dig into these strategies and both do advocacy at the funding levels and at the services levels and at the coordination levels to really realize these strategies and action steps to be able to meet our goal of ending youth homelessness by 2022. But I share, if you feel impatient, I share your impatience. And I think that's a fire that many in this room feel, and I feel strongly that we'll be able to take that and fuel our fire for doing the work. So I thank you for your comment. All right. Well, I'd like to thank everybody for coming. I would like to thank our panelists for sharing their expertise. I know I myself learned quite a lot today. I'd like to thank our speakers for coming from out of state to share their knowledge and expertise with us. It's invaluable. Again, I remind you, you can access all of the resources from today on the partnership's website. And don't forget, you have the, Beth, will you just hold up that flyer next to you? The flyer for the home stretch is right, if it wasn't on your seat, it's somewhere around your seat. You can fill that out and just leave it on or below your seat, and we'll sign you up for that event. It's going to be really fun. It's going to be here. We have a 50-minute showing of the Homestretch documentary, which depicts 3 youth from Chicago experiencing homelessness. We have food, and then we have a youth panel immediately following the movie. So we'd love to see you all here for that event. And I'd like to close out by thanking everybody. And for those who have already registered for the strategy lunch, we'll be meeting across the hall for that immediately following this. Thank you.